Good morning. This skill is a partial bed bath with a back rub. Let's begin. Hi, Mr. Smith. My name is Pam, and we need to go ahead and get you cleaned up today. All right, I'll be your Cena, but I'm going to wash my hands real quick before I collect my equipment. Wash your hands, and I'll be right back with the equipment. Okay, let's flip that over because your barrier should always be on top. It's the very first thing you collect. It'll help you in the process, knowing what to grab and what not. Always barrier first. Okay, get everything situated. As you see, I have a washcloth, a rinse washcloth. I have a new gown, and then I have a drying towel. But what I did forget is a chaser towel. Be right back. Okay, here's my chaser towel, and I'm going to go ahead and get my basins out. And again, my choice preference is a rinse and a wash basin. Get my soap and my linen bag. A lot of these skills have the same preparation. Mrs. Smith, I'm going to go ahead and get some more water, and I'll be right back. Again, making it warm to comfort, not hot, not cold. I want to emphasize gloves are not necessary in this skill. Now, if your circumstance changes and there's some fluids, or you'll need to, clean some areas with mucous membranes, you would have gloves, but in this, you do not. Okay? Mrs. Smith, let me close the privacy curtain, and we'll raise that bed so I'm not bending over. Let's get you up here, Taj. How are you feeling? Good. I'm going to take your colite. I'm just going to get it out of our way real quick. Okay. We have our wash and our rinse. Just hanging over the side. Again, soap stays in the soap bin. You never put it in the water. Alright, sort of get things situated. Drying chaser towel. And we're going to start with the eyes. Mrs. Smith, can you turn your head this way just a little bit? And I'm going to put this towel here just to protect your linen. Now, when you're cleaning the eyes, you do not use soap. Make your mitt. Now, I'm going to go ahead and with the pinky, Mrs. Smith, I'm going to go to the corner of your eye and I'm just going to pull down. Looks great. Changing spots, going to my index finger to the eye, inside of the eye, going down. How does that feel? Close your eyes for me, and let's go ahead and dry them. Okay? So we are going to wash your face, and we normally do not use soap. Do you have a preference of soap on your face? Okay, well, if that's the case, I'm not going to use soap, okay? So, I still have my washcloth, but it has been rinsed. I'm not using soap, so this actually is my wash and rinse each together. Okay? Just go around the eyes, you can go around the ears just a little bit. How does that feel? That's good. Okay, now we dry. Again, remember the saying, whatever you wash, you rinse, and whatever you rinse, you dry before you proceed on. Mrs. Smith, I'm going to have you lift your head, and we're going to put this underneath your neck. And at this time, I'm going to go ahead and untie your gown and just pull it down just a tad. And we're going to go ahead and clean your neck. So take your washcloth and make sure you have soap on it this time. Okay. Pull your table over. Makes it easier for you. And we're going to go ahead and we're going to wash around the neck. Can you lift you up a little bit? Sometimes you can go around the ears. Good. So since I've washed, I'm going to go ahead and rinse. It's repetitive. Okay, lift. Great. And whatever I washed, I rinsed, and whatever I rinsed, I dry. If you notice, I've used the chaser towel. That's fine too, but I do have an additional towel because if this gets damp enough, it won't protect your bedding. So, all right, Mrs. Smith, what I'm doing, you have a an injured arm over here. So what I'm going to do is we're going to go ahead and slip your good arm out. Support those joints when you're removing, dressing or undressing. And I'm going to go ahead and I usually just roll it away. Okay, and I'm going to take my chaser towel and I'm going to put it across their chest. Okay, for two purposes, keeping them warm and for privacy. I guess you could do it a third too. You want to protect the bed linen. Okay, so now don't get confused. You can do the chest and the arm, or you can do the arm and the chest. There is no exact way. Okay, so here we go. Going around the chest area. And you could go basically just down to probably about the umbilical area. Okay, just cover that up. We got that nice and washed. And let's do your rinse. Same way. Now there's no special way to, to change spots or anything for your partial bath. Go ahead and lift it up. Make sure you get all the soap off of it. Soap causes itching. And then again you go to your dry. You could use your chaser towel and you have your drying towel. Perfect. Go ahead and remove, recover. Now if you notice on your silver packet, they're only requiring you doing one arm. Okay, they figured probably if you know how to do one arm, you're going to do the other. So go ahead and protect your bed linen. Mrs. Smith, we're going to wash your arm here real quick. Okay, we're almost done. Now at this point in time, make sure that your water is not soapy and it also is not cold. Mrs. Smith, how's this water? Is it still feeling pretty good to you? Great. We'll go ahead and continue to use it. Okay, all four sides. And wash the arm. Notice again, I'm not concentrating on flipping sides or changing spots. It's a scrub like you scrub yourself. Okay, go into the underarm area and making sure that you wash the hands between the fingers. I usually leave the hand last. Okay, cover it back up for warmth. Getting my rinse out. Same thing. Please make sure you get all the soap off. And the underarm, the under area here, back down to the hand, between the fingers. And your last is to dry. Just go ahead and pat that area dry. Again, pat it dry under the arm. Lastly, the hand, between the fingers. Okay, we're all set there. Okay, we'll cover you back up, Mrs. Smith. What I'm going to do now is I'm going to go ahead and slip this off. Okay, I've got your arm supported here. You let me know if I caused you any discomfort. And now I'm going to go ahead and put a clean gown on her. And I'm going to dress her the opposite way. So where I undress the uninjured side, I am dressing the injured side first. So be very careful, fan fold it up, and just guide it through. This way you have lots of material to, because this arm can bend usually. And just slide their hand all the way through. Now you must make sure that you tie this gown, but we do that when they're on their back because we have yet a back rub to do. So Mrs. Smith, can you roll towards me so we can turn you away? Okay, scoot. Wonderful. One more time. Scoot. Okay. Let's put this over here at my barrier. Knee up. And we're going to reach together on 3. 1, 2, 3. Reposition your blankets to make sure they're covered. We're just going to wash your back and give you a back rub. So expose the area. Can you scoot this way a little bit? You're a little close to that edge. Thank you. You feeling okay? Let me fix this pillow for you. All right, with the back rub. The back rub, there's no concerns about changing spots, whatever, but it is important that you start at the spine and work your way up towards the neck. So I'm going to switch spots with you here. Start at the spine and work your way up like in a circular motion. Go back down and like little half C's. And you can do that a couple times because they really enjoy this. And you can also, again, right now, observe the back for any skin problems. Whatever I washed, I rinse. Let me put my chaser towel down to protect my bed. I do see some splash in here. I always put that chaser towel. So chaser towel, wash, rinse, dry. Let's rinse this off. Make sure the soap's all off. And we're going to go ahead and dry. And the main thing is going up from the spine to the neck. Last but not least, take your lotion. Very important to make sure it's warmed in your hands. Tell me if my hands are cold, Mrs. Smith. How's that feel? Good. And go up and outward strokes, all the way from the spine up to the neck. And you can do that a couple times. You could do it till it's all rubbed in. Regardless, take your towel because you have got to pat off the excess. How's that feel, Mrs. Smith? Okay? And at this point, you want to go ahead and tie your gown together at the back of the neck. Okay, let's pull this around. Good. Mrs. Smith, I'm going to have you roll back now. Perfect. Scoot to the center of the bed. Let me untangle your blankets for you. Put that over here. Twist it around your foot. There you go. And again, just scoot to the edge. Great. How are you feeling? Are you warm enough? Would you like the head of the bed up? You doing all right? All right, I'm going to go ahead and clean up my area here, and then I'll be back to get you situated. I'm going to go ahead, put the bed down. Again, as a habit, I always use the back of my knuckle, regardless if I have gloves on. It's just a habit. And probably one that would, be nice for you to pick up to as well. You won't ever wonder if your hand is dirty or not. So let's go ahead, clean up our area. It's right here. Get rid of your washcloth and your rinse cloth. Combine you two. This is above the waist, so I can dump this in the sink. take care of that right now. So it's in the sink. Our famous saying, whatever you wash, you rinse, and whatever you rinse, you dry. So we wash this one up. Soak this up a little bit. Rinse it out. Excuse me, when it dry. And one more. Put your equipment away where you got it. The barrier, wiping the table, and the linen bag. Mrs. Smith, is there anything I could get you? Would you like a drink of water? Would you like the TV turned on? Let me know if there's anything I can do for you. Straighten up the bed, courtesy of nursing. Okay, here's your call light. Okay, we're going to put it where you could reach it. We're going to put it on this side because your hurt arm is over there. And your bedside table is on that side too. Can I get you a glass of water? Nothing to drink? Okay. At this point, I'm going to go ahead, open up the privacy curtain, making sure I'm thinking of Quippers backwards. The bed is low. Privacy procedure. What else is next? Washing hands, that'll be last. Bed and low. Mrs. Smith, call me if you need anything, okay? Because I'm going to be taking off here. Just let me know. I'm going to wash my hands, take care of my dirty linen. That is the end of a partial bath with a back rub. Thank you.